these 3 things we can do right now to change our risk?
Reducing your alcohol intake. So 1 drink a day, up to 7 a week. Alcohol is linked with many cancers. Number 2 would be obesity or being overweight. So you want to maintain an ideal body weight. And number 3 is linked to regular exercise to maintain that body weight and no binge drinking. One would be the estrogen window. So someone who had their periods early, or they have late menopause, so they have a longer estrogen window, that tends to lead to higher risk of getting breast cancer. Past history of breast disease or breast cancer on yourself, and of course, cancer in the family, breast cancer in the family. Mapping out the family tree is very important because we look at which side the cancer is on. And even paternal, your father's breast cancer can affect you. And if there's a very strong family history, then you might go for a family cancer clinic and test your genes. Well, thankfully, only 5% perhaps of breast cancers are due to a mutated gene. And you would have heard of BRCA1 and 2.
Yeah.
Everyone knows about BRCA1 and 2. So they cause an increase in not just breast cancer, but ovarian cancers as well. We detect them by checking women's family history of how many patients with breast cancer in their family or ovarian cancer on one side, and that tells us of their higher risk. And they then present to a family cancer clinic, and based on that discussion, they might get tested. And if they're positive, then options are discussed with them. Is the option, intensive surveillance,
yes,
medical treatment, or is the option risk-reducing mastectomies?